Stop what you're doing right now. I want you to hold up your hands, both of them, and look at your nails. Really look at them. Not the polish, not the shape. I'm talking about what's underneath. The color, the texture, the little lines, the spots, the curves you've probably never paid attention to. Because here's what most people don't know, and what most doctors don't take the time to explain during a 7-minute appointment. Your fingernails are one of the most accurate diagnostic windows in the entire human body. They reflect what's happening in your liver, your lungs, your heart, your kidneys, your thyroid, right now, in real time. I'm Dr. Arthur Sterling, and I've been practicing medicine for over 40 years. And I can tell you with absolute confidence, I have caught serious diseases in patients who felt completely fine simply by looking at their nails. One patient came in for a routine checkup. Felt great, no complaints. I looked at her nails, saw a specific pattern I'm going to show you today, and within 3 weeks, she was in treatment for early-stage liver disease. We caught it before she had a single symptom. That's the power of reading your body's signals. Today, I'm going to walk you through 7 nail signs that your body uses to send you urgent messages. Some of these are warnings of conditions that, if caught early, are completely reversible. Others are signals of something that needs immediate medical attention. By the end of this video, you will know exactly what to look for, what each sign means biologically, and, most importantly, what to do about it today. Stay with me. This could genuinely change or save your life. Here's the problem. We live in a culture that treats the body like a machine that only needs attention when it breaks down. You feel fine, so you assume everything is fine. You don't have pain, so there must be nothing wrong. But disease doesn't work that way. The most dangerous conditions, liver disease, kidney failure, heart disease, lung cancer, they spend months, sometimes years, developing silently. And during that entire time, your body is screaming for help, through your skin, through your eyes, through your nails. According to the American Liver Foundation, over 100 million Americans have some form of liver disease, and the vast majority have no idea, because the early symptoms are invisible, until you know where to look. I want to tell you about a man named Robert, 58 years old, retired. He came to see me because his wife made him. He felt tired, but he blamed that on age. He had no appetite some days, but he blamed that on stress. When I examined his nails, I saw 3 of the 7 signs I'm going to show you today. Within 2 months, Robert was diagnosed with early-stage chronic kidney disease. Because we caught it at stage 2 instead of stage 4, his doctors were able to slow the progression dramatically with diet and medication. Robert told me, "I looked at my nails every day for 58 years and never once thought they were telling me something." That's exactly the problem. We've been taught to look for dramatic symptoms, chest pain, sudden collapse, visible tumors. But the body doesn't always work like a Hollywood movie. It whispers before it screams. And most doctors in a standard appointment spend less than 90 seconds examining your hands. They're looking at blood pressure numbers, cholesterol levels, prescription refills. The subtle visual signs, the ones your body has been displaying for months, go completely unnoticed. This isn't about blaming your doctor. The system is designed around crisis care, not prevention. That's why I'm here. That's why this channel exists. Your body is already giving you the information. You just need to learn the language. So let's learn it, starting right now. Before we go through the 7 signs, I want you to understand why nails are such powerful diagnostic tools. Because once you understand the biology, everything else makes perfect sense. Your nail is not just a hard plate at the end of your finger. It's a living structure fed by blood vessels, nourished by nutrients, and built by cells called keratinocytes, the same cells that form your skin. The nail plate, the part you can see, is produced continuously by the nail matrix, which sits underneath the skin at the base of your nail. It takes approximately 6 months for a fingernail to grow from matrix to tip. That means your nail is essentially a 6-month biological timeline of what's been happening inside your body. The pink color of a healthy nail comes from the capillaries, the tiny blood vessels running through the nail bed underneath. When something disrupts blood flow, oxygen delivery, or nutrient availability, the nail changes color. When the liver fails to process toxins properly, those toxins affect the nail matrix. When the kidneys can't filter waste, that waste enters the bloodstream and impacts nail growth. Think of your nails like a monthly financial statement for your body. Every line, every spot, every color shift is an entry in that ledger. Now let's go through the 7 signs. Keep your hands in front of you. Sign number 1, white nails with a pink strip at the top. This is called Terry's nails. The nail appears almost entirely white, with a narrow band of pink or reddish brown near the tip. Biologically, this happens when the blood supply to the nail bed decreases significantly. The capillaries that give your nail its pink color are being compressed or reduced, Terry's nails are associated with liver cirrhosis, congestive heart failure, and type 2 diabetes. In a landmark study, Terry's nails were found in 80% of patients with cirrhosis of the liver. If both hands show this pattern, see your doctor this week, not next month, this week. Sign number 2, yellow thickened slow-growing nails. Yellow nail syndrome is one of the most underdiagnosed nail conditions in adults over 50. When the lymphatic system, your body's waste drainage network, becomes compromised, fluid builds up in the tissues surrounding the nail matrix. This slows nail growth dramatically and causes a yellowish discoloration as keratin accumulates abnormally. Yellow nails can indicate chronic respiratory conditions including bronchiectasis and pleural effusion, fluid around the lungs, as well as lymphedema and, in some cases, rheumatoid arthritis. If your nails are growing noticeably slowly, we're talking less than 1 millimeter per month, and have a yellowish tint, that is not a cosmetic issue. That is a physiological signal. Sign number 3. Horizontal ridges, also known as Beau's lines. Run your thumb across your fingernails right now. Do you feel grooves running horizontally, left to right across the nail? Those are called Beau's lines, and they represent a moment in time when your nail matrix temporarily stopped producing cells. Think about what that means. Something happened in your body severe enough to halt nail growth. Beau's lines are associated with high fever, severe infections, metabolic disturbances, including uncontrolled diabetes, zinc deficiency, and in some cases, chemotherapy. Because nails grow at a predictable rate, doctors can actually estimate when the disruption occurred based on where the line appears on the nail. A line at the midpoint of a nail that grows 1 centimeter per month indicates a disruption approximately 3 months ago. Your nail is keeping a record. Are you reading it? Sign number 4, clubbing. Hold your finger sideways. Does the nail curve downward over a rounded, enlarged fingertip? Does it look like a small upside-down spoon? This is nail clubbing, and it is one of the most serious signs on this list. Clubbing develops over months to years as a result of chronic low oxygen levels in the blood. When tissues don't receive adequate oxygen, the body responds by increasing blood flow to the extremities, the fingers, and toes. Over time, this causes the soft tissue beneath the nail to proliferate, creating that rounded, bulging appearance. Nail clubbing is associated with lung cancer, chronic obstructive pulmonary disease, cystic fibrosis, congenital heart disease, and inflammatory bowel disease. If you notice progressive clubbing, especially if it's developed over the past year, this warrants an immediate conversation with your doctor and likely a chest x-ray. Sign number 5, spoon-shaped nails, also called Koilonychia. Does your nail curve upward at the edges like a tiny spoon? If you placed a small drop of water on it, would it hold? This condition is a classic sign of iron deficiency anemia. Iron is essential for hemoglobin production, the protein in red blood cells that carries oxygen. When iron stores become severely depleted, the nail matrix doesn't receive adequate nutrients. The nail plate becomes thin, soft, and eventually curves upward as tissue pressure changes beneath it. Iron deficiency anemia affects approximately 1.2 billion people worldwide. In adults over 50, it is frequently caused by slow gastrointestinal bleeding from ulcers, polyps, or in some cases, early colon cancer. This is why spoon nails in an adult should never be dismissed as a simple nutritional issue without investigation. Sign number 6, dark vertical lines, known as Melanonychia. Look carefully at each nail. Do you see a dark stripe, brown or black, running vertically from the base of the nail to the tip? A single dark line on one nail in a person of color is often normal. It's caused by increased melanin production in the nail matrix, which is benign. However, if you notice a new dark line, if the line is getting wider, if the pigment is spreading onto the surrounding skin, or if it appears in a person with fair skin, this requires immediate evaluation. Subungual melanoma, melanoma beneath the nail, is one of the most dangerous and most frequently missed cancers. It accounts for up to 31% of melanomas in people of African or Asian descent. Bob Marley died of subungual melanoma that was initially mistaken for a soccer injury. Any new dark streak that wasn't there 6 months ago deserves a dermatologist's attention. Not tomorrow. Now. Sign number 7, pale or white nail beds. Press down on your thumbnail for 3 seconds, then release. The nail bed should go white when you press and return to pink within 2 seconds. If the nail bed is already pale without pressing, or if the color returns slowly, this suggests reduced peripheral circulation or anemia. Pale nail beds are associated with severe anemia, poor cardiac output, and in some cases, peripheral artery disease, a condition where plaque buildup narrows the arteries supplying blood to your limbs. Peripheral artery disease affects over 8 million Americans and dramatically increases the risk of heart attack and stroke. It is frequently asymptomatic in its early stages. Your nail bed capillary refill is a free 5-second diagnostic test you can perform at home right now. Now that you know what to look for, here's exactly what to do. Follow these steps in order. Step 1. Do a systematic nail assessment today. Not next week, today. Find good lighting, natural light, or a bright lamp. Remove any nail polish. Examine each nail individually, both fingernails and toenails. Look for color changes, texture changes, shape changes, and any dark lines or spots. Take photos with your phone, date them. This gives you a baseline to track changes over the next 3 to 6 months. Changes over time are often more significant than any single observation. Step 2. Address the most common root causes nutritionally. Many nail abnormalities have nutritional components that you can address immediately while awaiting medical evaluation. Iron. If you suspect iron deficiency, spoon nails, pale nail beds, fatigue, increase your intake of lean red meat, lentils, spinach, and pumpkin seeds. Pair iron-rich foods with vitamin C to increase absorption by up to 67%. Avoid coffee or tea within 1 hour of iron-rich meals. Tannins block absorption. Zinc. Zinc deficiency contributes to Beau's lines and white spots. Sources include oysters, the highest zinc food on earth, beef, pumpkin seeds, and chickpeas. A 2017 study found that zinc supplementation at 25 to 45 milligrams daily significantly improved nail quality in deficient adults within 12 weeks. Biotin, a B vitamin critical for keratin production. Foods include eggs, almonds, sweet potato, and salmon. Studies suggest 2.5 milligrams of biotin daily can improve nail thickness and reduce brittleness in people with deficiency. I want to be clear, supplements do not treat liver disease, lung cancer, or heart failure. They address nutritional deficiencies that may be contributing to nail changes. They are step 1 of a 2-part process. Step 2 is medical evaluation. Step 3, know which signs require urgent action. These nail signs require a doctor's appointment within the next 7 days. Terry's nails, progressive clubbing, a new dark vertical streak, especially in fair-skinned individuals. Spoon-shaped nails in an adult with fatigue. Yellow, thickened, very slow-growing nails. When you call your doctor, say these specific words, and feel free to mention you learned this from Dr. Arthur Sterling. I've noticed changes in my nails, and I'm concerned they may be reflecting an internal health issue. I'd like a blood panel including a complete blood count, liver function tests, kidney function, iron studies, and thyroid panel. This gives your doctor the complete picture and ensures you're not dismissed with a generic, everything looks fine. Step 4, support your body's internal filtering systems daily. Regardless of what your nail assessment shows, these habits support the organs most frequently reflected in nail health. For liver health, reduce alcohol intake to 0 or near 0. Add 1 tablespoon of extra virgin olive oil to your diet daily. A 2018 study found this reduced liver fat markers significantly. Add cruciferous vegetables, broccoli, Brussels sprouts 3 times per week. These contain sulforaphane, which activates liver detoxification enzymes. For kidney health, hydrate consistently, aim for half your body weight in ounces of water daily. Reduce sodium below 2,300 milligrams per day. If you have high blood pressure, reduce it below 130/80. Hypertension is the second leading cause of kidney failure. For circulation and heart health, walk for 20 minutes after your largest meal of the day. This single habit has been shown in multiple studies to reduce post-meal blood sugar spikes, lower triglycerides, and improve peripheral circulation, the same circulation that determines your nail color. Step 5, recheck your nails in 30 days. Changes in nails reflect changes inside your body, but those changes take time. Nails grow slowly. If you've started nutritional interventions, you won't see overnight transformation. Check again in 30 days. Look at your photos from today. Are the ridges improving? Is the color shifting? Is a new sign appearing? Your nails are a monthly report card on your internal health. Learn to read them consistently, and they become one of the most powerful preventive health tools you have, and they cost absolutely nothing. I receive thousands of questions from viewers every week. Let me address the 5 most common ones I hear about nail health. But my doctor looked at my hands during my last physical and didn't say anything. I hear this constantly, and I understand why it's confusing. Here's the reality. A standard physical examination is comprehensive but time limited. Most physicians spend their exam time on cardiovascular and respiratory assessment, medication review, and screening protocols. Nail examination, unless you're seeing a dermatologist or a physician trained in clinical signs, often gets less than 30 seconds. This is not negligence. It's a systemic problem with how we structure preventive care. Your job is to be your own first line of observation. If you identify a change, you bring it to your doctor's attention. You point to it. You ask about it directly. You are your own best advocate. Don't wait for someone else to notice what you've already seen. I have some ridges, but I'm only in my 40s. Is this really something to worry about at my age? Age is not a protective factor for the conditions I've described today. Liver disease, iron deficiency anemia, and thyroid dysfunction affect adults in their 30s and 40s routinely. That said, vertical ridges running lengthwise along the nail are extremely common and generally benign. They become more prominent with age as nail hydration decreases. Think of them like wrinkles on the nail. The ridges to pay attention to are horizontal ones. Beau's lines running across the nail. Those represent a disruption event. If you're in your 40s and noticing changes, that's actually the ideal time to catch something early. The conditions I've described today are most treatable in their early stages. I've had white spots on my nails my whole life. My mother always told me it was a calcium deficiency. Your mother was wrong, and so was almost every doctor who repeated that to patients for decades. White spots on the nails are almost never caused by calcium deficiency. The most common cause is minor trauma to the nail matrix, bumping your finger, pressing too hard, that you've completely forgotten about by the time the spot appears weeks later. However, widespread white spots across multiple nails, especially combined with other changes, can indicate zinc deficiency, fungal infection, or in some cases, heavy metal exposure. Single white spots on 1 or 2 nails, almost certainly minor trauma. White spots across all 10 nails simultaneously, worth investigating. Can I take supplements to fix my nails without seeing a doctor? You can absolutely support your nail health nutritionally, and I described how to do that earlier. But I want to be direct with you. If your nail changes reflect an underlying condition, liver disease, kidney dysfunction, lung disease, no supplement will treat that condition. Biotin will not fix cirrhosis. Zinc will not reverse kidney failure. Supplements address nutritional deficiencies. They do not address organ disease. Use nutrition as your first supportive step and use it immediately. But if you're seeing signs like Terry's nails, clubbing, or spoon nails, that nutritional support must run parallel to medical evaluation, not instead of it. Your health is worth a doctor's appointment. Please don't let cost or inconvenience delay something that could be caught early and treated effectively today but become life-altering if left unaddressed for another year. How long before I see improvement if I change my diet? This depends entirely on what's causing the change. If your nail changes are nutritional, iron deficiency, zinc deficiency, biotin deficiency, you should begin seeing improvement in new nail growth within 8 to 12 weeks of consistent supplementation and dietary change. Remember, you're waiting for new nail to grow from the matrix outward. The existing damaged nail won't transform, but the new nail growing in will reflect your improved nutritional status. If your nail changes reflect an organ condition that's being treated medically, nail improvement follows organ improvement, which can take 3 to 6 months. Take your baseline photos today. Set a calendar reminder for 90 days from now. Compare them honestly. That comparison will tell you whether your interventions are working. What I want you to take away from today is simple. You are not helpless in the face of your own health. You are not dependent on a 7-minute appointment once a year to know what's happening inside your body. Your body is communicating with you constantly, through your skin, your eyes, your energy levels, and yes, through your nails. 7 signs. That's all it takes to read a story your body has been trying to tell you. White nails with a pink strip, yellow thickening nails, horizontal ridges, clubbing, spoon-shaped nails, dark vertical streaks, pale nail beds. Memorize them. Check your nails once a month. Take photos, track changes, and when something doesn't look right, act on it. Make the call, ask the question. The patient I told you about at the beginning of this video, the woman whose liver disease we caught early, she sent me a letter 2 years after her treatment. She wrote, "I used to think checkups were for sick people. Now I understand that checkups are how you stay well." That's the shift I want for you. Not fear, not anxiety, awareness. If this video gave you something valuable today, a new piece of knowledge, a reason to look more closely, maybe even a reason to pick up the phone and schedule an appointment, please hit the subscribe button right now and click the notification bell, because every week on this channel, Dr. Arthur Sterling decodes another signal your body is sending you. Your body is talking to you right now. The question is, are you listening?